In this region, this is a heavily industrialized region. Lots of workers still in their 70s and 80s who worked in the shipyards and had asbestos exposure. You're exposed in your prime of your life, your late teens, early 20s on the job, and here you are 30, 40, 50 years later with a disease that it's frightening. It's an absolutely frightening diagnosis.
Our location makes mesothelioma a vital issue. So we're in a prime location for a mesothelioma center because a lot of patients in our system have had asbestos exposure. Mesothelioma, just in and of itself, is a cancer of the lining of certain body cavities. So it can affect the abdominal lining, the heart lining, as well as the lung lining. People who are most at risk are people who have had exposure to asbestos. And the reason for that is they inhale asbestos particles. The body creates an inflammatory response to those asbestos particles over years and years of time. And eventually, a lot of people undergo malignant degeneration of those inflammatory areas.
It got to where I couldn't even bend over because I'd get dizzy and want to fall out. And I said, we need help.
Once we got with Dr. Cassidy and she did the biopsy and we found out it was mesothelioma, well, we was in shock.
I didn't know what to do.
It's not a common disease, but it's a devastating disease, and it is a very, very complex treatment algorithm, treatment strategy. The lung multidisciplinary care team really developed out of necessity. As care becomes more complex, it needs to become more coordinated.
Each patient and each case of mesothelioma that we're seeing is presented to physicians of multiple different specialties. We're able to meet regularly and collaborate on patient care. Even outside of those meetings, because we're all located here at Perkins, we're able to discuss patients as we see them, as issues come up, as plans change or treatments are being undergone. And for patients who really prioritize being near their family, friends, and support system, I think this is a really good option for them specifically to be able to stay close to home and be able to undergo the same treatment that they would get elsewhere right here in their own hometown.
Our patient navigators are specially trained and specially skilled at being able to sort of speak the language of physicians, understand the language and plans of physicians, and translate that into relatable language that the patient can easily understand. Not only that, but they really stay on top of patients as far as making sure they get to their appointments. If there's transportation issues, Navigator has direct lines to all of the care team.
I would recommend anyone to stay here at home. The care is excellent.
We have multiple expert minds who sit in a room, talk about your problem, talk about you specifically, and come up with the best diagnostic and treatment strategy for you. That really is where we can deliver personalized care.
We want people in the Gulf South to know that we are here, we're available, we have a multidisciplinary care team who is experienced with treating this complicated disease process and providing an individualized treatment plan closer to home.